Hello and welcome to Lyra Nara. In this video we're going to talk about joint and bone diseases such as rheumatism, arthritis, cartilage degeneration, etc. We're gonna discuss the causes and show you a very interesting, well substantiated method that is backed up by a lot of scientific research that can help you with these painful conditions. But before we do that, just a small reminder that for a limited time only you can get some of the most powerful holistic health devices over at lyranara.com for amazing prices during our current sales action. Take advantage, some of those devices are also great for dealing with your joint and bone conditions. And also, if you enjoy this type of content where we talk about holistic health solutions, please like, share and subscribe, support our channel. Also hit the notifications button so you don't miss out on the weekly health content that appears here. So, without further ado then, let's learn more about joint and bone diseases and an interesting method to deal with them. Let's start by talking about rheumatism. Rheumatism is a generic name for 150 different conditions that are all characterized by inflammation and acute or chronic pain in the muscles, joints, or fibrous tissue. And rheumatism starts usually with a psychogenic trigger, a self-devaluation conflict, a lack of self-esteem and self-confidence, the feeling that you make no progress and that you have no resolutions to your problems. And the more you lose your joint mobility and are overwhelmed by the unbearable pain and stiffness, the more acute this self-devaluation conflict will become, and the more your joints and bone disorders will advance. They will become chronic, and this is of course a vicious circle. Another reason for rheumatism is overeating and overdrinking for years, which will cause a sluggish and dysfunctional digestion. Food is not properly digested, therefore, and many poisons and wastes accumulate in your entire organism, especially in the lymphatic system, and the body becomes tired and exhausted due to the overfeeding and the self-poisoning. An excess of fats and proteins clogs the internal layers of the intestines where food is absorbed, and morbid bacteria created by the rotten waste develop foul gases in the intestines which spread into the entire body. Thus, your metabolism is impaired, the blood circulation slows down, and a lot of energy is lost that is needed to maintain the body healthy and alive. People are also often freezing, feel downhearted, and cannot sleep well. Rheumatism in all its manifestations can become deadly unless the lifestyle is dramatically changed. Gout, one of the rheumatism diseases, appears especially in individuals who often consume all kinds of tasty delicacies, so sweets, and have also soft and voluptuous flesh body. What happens here is that the body fluids with low viscosity and poisonous chemical composition overflow and multiply so much that it becomes impossible to restrain them. And finally, these fluids are stored in the legs and feet, where they are changed into slime. Such a person has strong pain in the legs and feet, and with time will not be able to walk anymore. Women, by the way, suffer way more rarely from gout, as they excrete these juices through menstruation. Once in menopause, though, gout can also be found more and more in females. And major symptoms of rheumatic conditions are pain, acute or intermittent, so chronic, impaired mobility, joint stiffness, fatigue, and lactic acidosis. Next on the list of very common joint and bone disorders is arthritis. It's one of the most spread joint conditions, with over 58 million Americans suffering from it. Osteoarthritis is also called wear and tear that involves the cartilage degeneration, and it occurs more frequently than rheumatism or rheumatoid arthritis, which still affects about 21 million Americans. It is cited as the main cause for over 500,000 knee replacements per year. and it is supposed to be caused by a sedentary life and wrong nutrition, so junk food, overeating, meat, etc. Rheumatoid arthritis originates from rheum, meaning migrating between joints, and itis, meaning inflammation, plus the arth part means joint. And since 1928, when Dr. Homer F. Swift theorized that rheumatic arthritis is caused by the Streptococcus bacteria, many others have documented that RA is a result of infectious diseases caused by different bacteria, viruses, and fungi such as Streptococcus, Lyme mycoplasma, chronic hepatitis, gonorrhea, chlamydia, ureaplasma, cat scratches, the herpes virus, CMV, the parvovirus, the retrovirus, the parvovirus B19, Staphylococcus aureus, and Salmonella intestinal infections. And these pathogens lead to a buildup of calcium and painless nodules that wall off and surround the infected places, which are located under the skin. And these pathogens can also invade the lungs, causing shortness of breath. They can also invade the eyes and other organs. Both RA and OA may be combined. They might appear in the same individual at the same time, and the therapy in this case will challenge both patients and doctors. One of the following symptoms are experienced by all arthritis sufferers: swelling, redness, warmth, pain, tenderness or irritation in one or more joints, stiffness around the joints upon awakening or standing up, reduced mobility and painful joints, can also affect one or more joints and other organs as well, and rheumatic diseases exhibit inflammatory destruction of collagen proteins which held the cells together in the synovial tissue, the blood vessels and the skin. Inflammation occurs in the synovium tissue lining the joint, causing pain and stiffness, especially in the morning due to the lower temperature during sleep. The tendons that connect the muscles may also be affected as the sheaths containing the tendons become inflamed, and scars that are formed may immobilize completely the limb. We also need to talk about another problem, that is cartilage degeneration. Cartilages are of course essential for body structure and represent 1/3 of the connective tissue weight, and there are 4 types of cartilages. First, fibrocartilages. They are notable for their tensile strength and their ability to resist breakage, and they are found primarily between the vertebrae and in some interarticular areas of the joints. They contain thick bundles of collagen fibers. Then we have the so-called articular cartilages. They are found in the joints and have the resilience to rebound from compression and enable the bones to slip over one another. Next, we have the morphological cartilages, such as those found in the nose and the ears. And the fourth type is the so-called elastic cartilages that are found at the front of the rib cage, and they allow for the expansion of the thorax. What happens with the cartilages is that destructive enzymes such as proteoglycanase attack and break down those cartilages and the collagen. The absorption of nutrients is poor therefore, and the cartilages erode, and the exposed fibrous ends act as irritants for the joints capsules. And following the immune system response that occurs, the destruction of collagen proteins that hold the cells together happens. Scar tissue and bone gradually replace the eroded joint regions, causing irregularly shaped articulating surfaces. Exposed to the repeated mechanical stress, the bone becomes stiff through a series of healed and calcified microfractures over time, and the stiffer the bones, the more the nearby cartilages degenerate. Cartilage erosion can have etiological causes through what is called chronic tension, which results in sustained isometric muscle contraction of numerous joints, like for example a sustained compression of the intravertebral cartilages in the cervical spine and the discs. Bone friction and destruction is a feature of OA, and the same joints may be affected by both rheumatoid arthritis and OA at the same time. And as the body tries to repair itself, new cartilages may grow, abnormalities seen as knobs under the skin and protruding from the area around the joint. Because the cartilages do not have nerves, this deterioration process may progress unnoticeably until serious pain and swelling occurs. And when the cartilage surfaces become abraded, the body sends antibodies to attack the exudates of debris, and otherwise this would have been removed by the white cells in case, of course, of a healthy immune system. And OA is also characterized by calcium deposits which accumulate as bony spurs on pressure points and impinge on nerves. One of the major causes of these joint and bone disorders are microparasitical infections. In a rheumatic patient's history, you will always find exudations. Exudation is a fluid rich in protein and cellular fragments that oozes out of blood vessels due to inflammation and is deposited in nearby tissues. The devastating capillary destruction caused by the microparasite's extravasal proliferation allows the passage of poisonous food residues as well as of protozoa into the connective tissue and bone marrow, and as a result you get anemia or leukemia. Another problem with these microparasitical infections are relapsing urogenital infections. With massive antibiotic treatment, some of the symptoms can be temporarily suppressed, but you will get endless infection relapses. Late stages of rheumatic disorders lead also to malign tumors, cysts, and hyperplasia. And usually cancer therapies such as surgery, chemo or radiation, or autoimmune specific drugs such as corticosteroids or non-steroidal anti-inflammatory drugs sedate only the symptoms with a price of enormous side effects and even life risks. And the microparasites move through the connective tissue with disastrous effects, destroying the cartilages, the collagen, exudations, and lots of pain or impaired limb mobility. You also get digestive tract disorders, many related to the mucosa of the stomach or intestines that cause gastritis or ulcers or morbus Crohn disease. And the protozoa invade also the stem cells in the erythroleucopoietic system, so the bone marrow, and disturb the metabolism in the bones, the cartilages, the tendons and ligaments, so the collagen and the elastin. And the musculoskeletal system is tremendously lacking therefore in nutrients and accumulates toxins due to the excessive cellular debris. The calcium metabolism is also inversed, and instead of adding calcium to the bone mass, calcium is removed from the bones and deposited elsewhere. For example, in the arteries. Therefore, the bones become brittle, decalcified, irregularly shaped with rough surfaces. And the worsening of the rheumatic symptoms is an anguish process. Sometimes it also depends on weather changes, the psychosomatic state, nutrition, and many other environmental factors to which the protozoa adapt very quickly. There is also no genetic factor that causes rheumatism, contrary to popular belief. It's just an epidemic infection with microparasites that migrate from mother to child during the embryonal life. Sometimes the microparasitic infection runs in the whole family, otherwise there is no heredity. And now that we understand better those bone and joint conditions and how and why they develop and what happens in our organism, let's talk about a very neat, relatively new and well-researched method that works wonders. For many years, the gold complex salts have been used in the treatment of rheumatic conditions. Some side effects made this therapy, however, pretty risky. To avoid the side effects of gold salt therapy, it has been replaced recently and more by gold implantation of metallic 24 karat gold, and this is absolutely risk-free. Gold can be implanted in different acupuncture points. One theory is that gold implants are permanently stimulating the acupuncture points, or that the metallic extra pure 24 karat gold interferes directly with inflammations and infections, thereby helping regress this and relieve pain. In Europe, gold implantation is practiced nowadays on humans as well as animals. And in North America, unfortunately, so far it is only allowed for animals. How does it work? Gold is implanted close to the painful points in the joints using two methods. One is classic gold implantation, whereby little cylindrical gold wires with a diameter of 1 to 2 millimeters made of 24 karat gold are implanted under local narcosis. And these implants are close to the joint's capsule but are not inserted directly into the joint. The number of implants can vary from 10 up to 60 pieces. Then we have the so-called Berlok implantation. At the University of Aarhus in Denmark, a team developed a method using gold implants in form of very thin wires that are coiled to enlarge the active surface. This therapy is more expensive as the classical gold implantation because the manufacturing of the coiled implants is more expensive. Since 1996, over 9,000 patients have been treated using gold implantation. Danish physician Dr. Kierkegaard first introduced this method to humans after he applied this method successfully to dogs, cats, and horses for many years. If for decades gold implant therapy works so fantastically for our pets, why shouldn't it work for humans, was his thought. The question, of course, is why is this method that has a very good track record and has been used already for almost 20 years and more, why is it not promoted more and supported by our healthcare insurances? I let you decide for yourself. The facts are that all patients with degenerative, traumatic or infectious joint chronic disorders can benefit of this therapy method. It's ideal for patients with urgent need for pain relief, for chronic pain conditions, for osteoarthritis of the neck and lumbar region, for arthrosis of the hip, knee, hand or ankle, and also patients with cicatricial tissues resulting from disc prolapse operations or patients with disc prolapse who cannot be operated due to the location of the prolapse. Also for patients wishing to avoid the implantation of artificial joints. What can you expect after a gold implantation? Following observations made by clinical surveillance of more than 9,000 treated patients, those are the expected results. More than 90% of these patients experience complete pain relief or a significant reduction in pain. In some cases, significant pain relief can be expected immediately after the treatment. In most cases, the patient will feel some minor tension following the treatment in the areas where the gold is embedded, and the local hematomas may also occur. A few patients may feel a worsening of pain for a short period of time only, and most patients experience the relief of pain in the following weeks. How and why does it work then? Well, at the beginning it was considered that gold as a noble metal has no interaction with the tissue and therefore it behaves like an inert compound. In 2002, however, it was discovered that gold metal generates gold ions in humans and animal tissue. Thus, the knowledge acquired in the study of gold salts is also applicable to gold implants, namely that there are gold ions and there is an interaction between those gold ions and the tissue without side effects. In 2008, a study performed by Professor Duncher from Aarhus University demonstrated that gold ions inhibit inflammations. Gold ions diffuse out into the surrounding tissue also, and the gold ions were found in the connective tissue and in mast cells, as well as in the macrophages and fibroblasts. Initially, it was hypothesized that gold implants act as a continuous acupuncture stimulation. However, more plausible and scientifically accepted today is the explanation that gold ions inhibit the cytokine HMGB1, which triggers inflammatory processes. In 2012, a genetic modulatory influence of gold ions was experimentally proven. The great thing about this therapy is that these 24-karat gold implants show absolutely no toxicity. Patients do not develop infections, they do not reject the implants, they do not feel any discomfort also related to this implanted gold. And the X-rays obtained years after the implantation of gold have demonstrated that the implants are still situated in the exact location where they were implanted initially. There are also numerous clinical and double-blind studies today to support the gold implant therapy as being best suited for rheumatic diseases with a significant pain relief and a mobility increase. It was proven that the immune system boost triggered by the gold ions also treats the microparasitic infection. And to stop rheumatism evolve and clear completely all of the symptoms, you must, however, also change your lifestyle and the state of your mind and your emotions. Gold therapy has actually a long tradition of hundreds, if not thousands of years, and it is nowadays being rediscovered. In the 12th century already, Hildegard von Bingen recommended for rheumatic conditions to consume gold dust cookies. The finest gold powder does not dissolve, stays in the organism for about 2 months in the stomach, and does not attack the stomach mucosa membranes and will help you get rid of your rheumatism. And here you have a list of some of the gold implant studies that have been published so far. Before we finish this up by looking also at some testimonials from people who underwent this type of gold implantation, I would like to remind you that if you have any questions, we are here to answer them. Just give us a call 1-888-773-3196. We love to talk to you and advise you on what is best for you. Also, do not forget to take advantage of our current sales action. Limited time only, you can get some of the most powerful holistic health devices that can also help you with your joint and bone conditions for unparalleled prices. Link in the description box below. So, with all that being said, let's look at some testimonials and stay healthy until next time. Walking without pain. For many years that was unimaginable for Corinna Richter. The 49-year-old has been suffering from arthrosis in both knees for many years. It became so bad that I also started having pain in my feet and hips, so I had to do something. I think that I'm too young to receive artificial knee joints. I've always asked myself if I have to go down this route or if I can avoid it. I used a cane for walking. Long walks were not possible. I could only walk for a maximum of 2 kilometers, but that was it, and only with a cane. She read about the gold therapy in a magazine and informed herself more over the internet on the subject as to where this therapy is performed in Germany. This is how she got to Dr. Endrizzi in Düsseldorf. She is one of only 4 doctors who use this method in Germany. The surgeon came to this method through her own experiences. I suffer from a very severe knee arthrosis from an accident, and I was very close to having a surgery for an artificial knee joint. So I looked for alternatives. I found a number of them, including certain types of physiotherapy, pain medication. I tried them all out, and they all brought only short-term relief. What helped Dr. Melanie Endrizzi long-term was the gold therapy. That brought her to the decision to take a 5-month training course with a gold implant specialist in Denmark. Since January 2015, she performs this procedure herself in a private clinic in Düsseldorf. With this method, some gold pieces are implanted through a cannula onto the points where the pain is coming from under local anesthesia. The gold can be implanted easily through the cannula, a relatively new method that has already helped a lot of patients. A professor in Denmark has committed himself to finding out why this works and how, and he has been able to observe under an electron microscope that the gold ions can be found in the inflamed cells. We assume that the infection is a biochemical reaction and the gold seems to block this biochemical process, so that the end result is a pain-free patient. Becoming pain-free is the main objective for the patients. Corina Richter is certainly doing way better since the treatment. I'm doing much better. I still take the cane with me on walks just to be safe, but I do not need it anymore. I can move freely again. I am not completely pain-free yet, but it is greatly reduced. And all of this is due to the pure gold in her knee joints that also has no negative side effect. We use 24-karat fine gold. You get no adverse reactions from your body, it has no allergic potential, and it is not being treated as a foreign body.